Welcome to our channel. In this video, we will see what you should know about lupus during pregnancy. Before we begin, please like this video, give it a thumbs up and share it with your friends. For more information, please click the links in the description. There are some things to consider for women with lupus who are pregnant or want to become pregnant. Although it is quite possible to lead pregnancy with the disease, the controls must be strict. The combination of lupus and pregnancy is possible, especially nowadays when the therapeutic management of the disease has improved enormously, thereby reducing the side effects of prescribed drugs. Keep in mind that a large part of the problems linked to the combination of lupus and pregnancy come from pharmacology. Indeed, drugs aimed at reducing lupus attacks usually cause infertility or malformations of the fetus. Therefore, it is always advisable for affected women to plan their pregnancy well in advance so that the doctor can adapt the treatment to the situation. Today, this is possible thanks to the development of active principles which replace the previous ones. As we will see in this video, with proper planning, women who suffer from lupus disease are able to experience pregnancy relatively safely. They have to undergo more checks than normal, but this is doable. What is lupus? Lupus is an autoimmune disease. In other words, the immune system itself attacks its own cells without knowing them. It identifies certain tissues as external or threatening and inflames them through a reaction similar to that which occurs during the fight against viral or bacterial diseases. In addition, this pathology is chronic and progresses in the form of aggravations. There may be periods of inactivity where there are no symptoms. But then there are acute episodes that are severe and disabling. The tissues most affected by the disease are the joints, the skin, and the kidneys. The lungs and brain are also affected, but the characteristic symptoms come from the joints and the skin. When we talk about lupus and pregnancy, we are referring to a woman who has been diagnosed with lupus and who becomes pregnant at some point in her life. Likewise, there are data that indicate an increased incidence of pregnancy problems among these women. On the other hand, there is also a point disorder, which does not always occur, and which is called neonatal lupus. This happens when the baby receives the antibodies that the mother has that are responsible for the illness in her. The child will then have skin and blood problems, and in severe cases, he may suffer from heart problems. Medicines for lupus and infertility. To talk about lupus and pregnancy, we must first talk about lupus and fertility. In reality, affected women should have no more difficulty getting pregnant. However, drugs play a key role. Indeed, people suffering from this disease receive drugs that can impair the ability to become pregnant. For example, a common drug in treatment programs is cyclophosphamide. It alters the viability of the ovaries in the long term. It is therefore essential that women who wish to be pregnant, and who suffer from lupus, consult well in advance. Therapeutic programs can, therefore, be modified to promote fertility. Some doctors combine cyclophosphamide with another medicine called leuprolide, which reduces infertility. On the other hand, several drugs for the treatment of lupus are teratogenic. In other words, they can cause birth defects in the fetus, especially during the first trimester. This is another matter to be discussed beforehand with the attending physician. Complications during pregnancy. During pregnancy, a woman's lupus can complicate matters compared to a normal pregnancy. Among the most common complications, we can cite hypercoagulation. Pregnant women may be prone to clots that interrupt blood flow to the placenta. Miscarriage. Women with lupus are 10% more likely to have a miscarriage. Preeclampsia. This syndrome consists of an increase in the woman's blood pressure, with edema in the lower limbs as well as protein losses in the urine. It is a type of high blood pressure which, although generally induced by pregnancy, is attributed in this case to this disease. Premature delivery. The above conditions can speed up labor and advance birth. Despite the complications, lupus and pregnancy are compatible. Women who receive this diagnosis and wish to be pregnant must consult their doctor in order to plan this experience as well as possible. The proper course of pregnancy will depend on this planning. Thank you for watching. You can watch more videos by clicking the links in the description. If you like this video, give it a thumbs up and share it with your friends.